I learned about migraine surgery during my residency. It is part of our core curriculum in the plastic surgery residencies and all of our plastic surgery textbooks. But the most I learned was from one of my mentors at University of Virginia, Dr. Jonathan Black, who built a migraine surgery practice while I was in residency. What about those patients that I remember the most was actually his description of them when I first started working with him. And he said that when you first meet these patients, you open the door to their clinic room and the lights are off and they are just very tense. There's this atmosphere of just anxiety and apprehension, and they talk very slowly and you can tell they're very much in pain. And then when you see them in their post-operative visits and seeing somebody, just the light inside of them has come back, it's a true huge difference that you notice in these patients. And I remember him describing that to me, and then I would witness it. And it was so tangible, the difference that it had made, and seeing patients smile and just be happy and feel like they could actually live their life pain-free or with a significant reduction in their pain burden. So once we have really developed clarity in which nerve is involved causing your migraine, depending on that site, we make a small incision either hidden in the crease of your eyelid for frontal migraines or hidden somewhere in the hairline for temporal and occipital migraines. That incision is usually about 1 to 2 inches long. You dissect down to a known tissue that is compressing that nerve. So depending on where it is, there's certain muscles that you remove. There's fascial bands that you might remove. There's blood vessels that can be involved with those nerves, and that gets released. So the nerve is released. In some cases, the nerve is transected and buried in a nearby muscle. I typically estimate about 2 hours per trigger site. So some patients might be having more than one trigger site released. So that would be additive. Some patients do report immediate relief. It can be pretty common, actually, that patients will have a migraine as they're waking up from surgery that then goes away within the next day. Usually it's an immediate relief up to about 4 weeks. I don't consider a surgery as incomplete treatment until about the 4 or 6 month mark if we've seen no improvement. So it can be pretty common that once you rid a patient of their primary trigger point, it can then unmask a secondary trigger point. So essentially, the major component of their pain was from this primary trigger point. And that pain was so severe that they didn't really notice this minor pain from a secondary trigger point. I like to perform the surgery under general anesthesia. I don't like to flood the field with too much local anesthetic that would be needed to make the patient comfortable. I think it can distort things. So personally, I do like to perform it under general anesthesia. And then I would inject some numbing medicine at the end just to help with that immediate postoperative pain. A migraine surgery patient, in order to prepare for their surgery, I would still like you to continue paying particular attention to where your migraine starts, any changes in that. If you are on chronic narcotics and work closely with a pain medicine specialist and they feel like you could potentially wean those narcotics, I would like that. Studies have shown that patients on chronic narcotics tend to have slightly lower success rates in migraine surgery. Continue taking your migraine medications. Don't stop them just because you're having surgery. And then, of course, stop smoking 6 weeks before surgery. So the literature quotes 86.6% of patients report improvement in their migraines after trigger site deactivation surgery. And 36.6% of patients report complete elimination, meaning their migraines are gone. So risks of this particular surgery: anytime you are manipulating nerves, you run the risk of a neuroma, which is kind of an enlargement of that nerve that can become painful, or similarly like neuropathic symptoms. That's pretty rare because if you transect the nerve, we bury it in a muscle to prevent that. In majority of cases, you just release the nerve. In places like the forehead, if I need to remove a muscle that's compressing the nerve, sometimes that can cause a contour irregularity. We can do fat grafting to prevent that. Where the scars are made in your hair, we make them pretty short and pretty thin. So there is a slight risk of alopecia in that area where the scar is, but that is very low risk. And then the biggest one that I would counsel with my patients is just incomplete relief, either because you have a secondary trigger point that we couldn't find because your primary trigger point was so powerful, or you have another underlying cause for your migraines. You might be a good candidate for migraine surgery if you have severe migraines that are disruptive to your life, migraines that don't respond to medical management, or you just don't tolerate those medications, or Botox injections for whatever reason, or the side effects are not tolerated. If you are losing numerous days at work or at school because of your migraine headaches, and most importantly, you have an identifiable trigger site that I can surgically decompress. Interestingly enough, studies have shown that adolescents can have a positive response to surgery. Those studies focus at about an age of 16 years. I will take it on a case-by-case basis, but I'm unlikely to operate on a patient younger than 15. When you call our clinic or text our clinic, we will ask you to keep a migraine diary, and lots of patients kind of already know this. But part of that migraine diary, I want you to have a sketch of where your migraine is starting and where it radiates. And we will provide that for you. We have little figures for you to draw on a skull where your migraine is starting, and then with an arrow showing where on your cranium it is spreading. I want that. I want you to have a diagnosis of migraine headache by your neurologist. I will see you. We'll go into your migraine history and your medical history pretty detailed. I might use a Doppler ultrasound to see if I can identify any blood vessels in the area that could be compressing that nerve. If you come in with an active migraine, I might inject numbing medicine to where your trigger site is, and we assess whether or not that migraine either goes away or is improved upon. That can help me more specifically identify your nerve that might be causing your migraine. And then I will also likely inject Botox where I think your trigger site would be. You'll continue keeping your migraine journal and tell me whether or not you had improved complete elimination, improvement, and like how much improvement. Was it 10% improvement, 50% improvement, etc. I need to see my patient in person before moving forward with surgery at least once. I think discussion of your migraine history and your migraine diary can be done virtually, but that wouldn't obviate the need for me to see you in person. So patients who should not have migraine surgery are any patients who, their cause of headache might be due to some sort of other intracranial or spinal cord disease. Any patients with what's called red flags, so other neurologic deficits, night sweats, fevers, chills, anyone with known intracranial pathology on imaging. So if you have a known mass or a known hemorrhage, anybody with increased pressure. So basically other neurological diseases of your brain. You should not have migraine surgery for treatment of your migraines. Patients who are on chronic narcotics should just be wary that according to the literature, you have a less likely chance of having a positive response. Patients that have any psychological comorbidities, I'd like those to be optimized by their psychologists and treated. Any smokers, like I won't operate on an active smoker, obviously, just other general things that preclude surgery in an otherwise healthy patient. So immediately after migraine surgery, I will want you to have somebody with you for 24 hours because you've had a general anesthetic. Usually patients return normal activities of daily living within 1 week, probably a little bit earlier. Definitely majority of patients feel ready to return to work by the 1 week mark, and then full activities at 3 weeks. So you can get back to the gym if you wanted to. I'd like to see you 1 week after surgery just to check the incision sites and then give you the clearance, like weight bearing restrictions at the 3 week mark. I would like to see you then. The most common thing that patients will complain of is numbness in the surgery site that usually gets better over the course of the 2, 3, 4, 6 months. Sometimes there's like an itchy sensation that's just the nerves that were being irritated with either retraction or just decompressing them. And also, I think I mentioned this earlier, a lot of patients will report a migraine immediately after surgery that goes away within 24 hours. Most patients that have a positive response to surgery notice immediately. So in the month after surgery, they have fewer migraine days. I don't consider surgery as incomplete treatment. I think I mentioned this earlier, until we've seen no improvement after about 4 to 6 months. On your day of surgery, you will come to our state licensed ambulatory surgery center at Basio Aesthetics and Plastic Surgery. It's on Town Lake in Cypress, Texas. You will meet with our wonderful preoperative nurses who will get your IVs set up. They'll go through your charts. They'll go through all of your medical history just to confirm everything. You'll meet with our anesthesiologist that day who has already reviewed your lab work, your EKG if we ordered one. You will go into our operating room. You'll take a nice little nap, and then you will recover in that same surgery center. Your driver can stay at our surgery center if they wanted to walk across the hall to our med spa to spend some time there. They're welcome to do that, or they can just go home or go out to eat. There's plenty of things to do in Cypress. We're right across the street from wonderful outdoor mall with great restaurants. We're on the lake, and there's also a boardwalk right nearby on that lake. Dr. Mary Ellen Farrat is our board certified anesthesiologist who has worked with Dr. Basu for, I think, upwards of 15, 16 years. And she is the most lovely, smart, safe doctor I've ever met. And she takes great care of her patients, and she makes patients feel extremely comfortable that they're being well taken care of. Patients who have had migraine surgery say that their life has been changed and they've been granted a whole new sense of control in their life. So you can book a consultation with me for migraine surgery at Basu Aesthetics and Plastic Surgery by calling or texting the phone number in the notes below.
Basu Plastic Surgery is located in Northwest Houston in the Town Lake area of Cypress. To learn more about the practice or ask a question, go to basuplasticsurgery.com/podcast. On Instagram, follow Dr. Basu and the team at Basu Plastic Surgery. That's BASU Plastic Surgery. Behind the Double Doors is a production of The Axis, THEAXIS.io.